Welcome, everyone. I see some people still kind of making their way in from our waiting room. Let's see, we're going to turn off our waiting room so people come later. They can just join us straight away. But welcome and thank you so much for joining us this afternoon. I'm Megan Trezza, founder of La Jolla Learning Works, and I am very excited, probably along with you guys, to learn today about neurofeedback from Dr. Divya Kakaya. Dr. Kakaya is a psychologist and neuroscientist who founded Healthy Within, which is a clinical practice that provides neurofeedback. And I will pass it on to her. She will fill you in on what that means, who that's for, and how it works. And then we will be able to address any questions you guys have at the end. So feel free to open your chat box and enter any questions, throughout, and we'll take some time at the end to address those if there's any questions we haven't already addressed during the talk. So with that, we are gonna take it away, Dr. Kakaya.
Thank you, thank you, thank you. I had kept my my microphone on mute because occasionally there are some amazing planes that like to go above here because I'm in Sorrento Valley. So if you guys see me turn it off for a second, it's just because of that. So I just thought what I would do, and Megan and I have been, cross-referring to each other for a long time now. And I know that there's a lot of interest that people have in learning about ADHD, attention deficit, learning disabilities, and the reason I like to do this presentation is because I always want to make sure that what I make available for all of you is learning about neurofeedback as a treatment modality that regulates the brain. So you can tell, my background is in clinical psychology, practicing for a long time now. And I've been doing neurofeedback in my practice for about 11 years now. So I was in a different world, and this is something that is my passion. This is what I do all the time, and I've become quite a seasoned expert with neurofeedback. So and please know that at any time when you have any questions after we finish the presentation, I'm very happy to take emails and answer any of your questions. So feel free to do that. And Megan, my email was on that first slide. It's drkakaya@healthywithin.com. But
Yes.
feel free to email me and ask me any questions. So I do like to start out my presentations with talking about how most of us psychologists go to grad school and we do not hear about neurofeedback, neither do we hear about biofeedback. So those are two treatment modalities that are very behavioral based modalities that actually regulate brain physiology and body physiology. And what actually brought me into the world of neurofeedback, and I like to talk about that because it sort of came for me through my son's brain, which is where he had inattentive ADD. And so I knew from the time he was first, second grade that, oh, this little guy that I'm watching over here, we're going to have some challenges with that brain. And so when he was in sixth grade, it would take me like 3.5, 4 hours before we would complete his homework. So I knew that there were some processing issues and we needed to do that. So right around that time is when I was working on my postdoctoral degree in psychopharmacology, and ran into a colleague who was doing neurofeedback and raving about neurofeedback. So that's how I got introduced to this magical world that I'm in right now, was through actually having someone else work on my son's brain, and then me entering the world of neurofeedback when I realized what a potent modality that is. I definitely, and I was working, I have that postdoctoral degree in psychopharmacology. In about a year or so, I should be able to get licensed for me to be able to prescribe. I am kind of crossing the T on that. And in a couple of years, psychologists in the state of California should be able to prescribe medications. So I am not anti-medication, but I really worry about how over-medicated our country is. So that's one of my big biases that I work with, that I operate from. And I'm never one to say, oh, take your kids off the meds, because there are many of our kids who need to be on those meds. But we also need to take a look at how in the long run, those medications don't necessarily really help for the longer issues. I have huge biases about us parents making mistakes. Okay, there's no way in which we parent without making a shit ton of mistakes. So we're all going to be making a lot of errors along the way. Even those of us that have these, postdoctoral degrees and all that kind of stuff. And that I think a big bias I have is about looking at deeper connections within our families. And I think that with the screens that have come in, and we all know that post-COVID, we're all really syncing with that. So it's going to be very challenging for us to kind of normalize our families right now post-COVID. So any of our kids with learning issues, with ADHD, that's going to be extra work for us as we enter here. I'm very hopeful, though, that if we do certain specific things within our family, we're going to really come out of this with some newer priorities that we create for ourselves. It's very important that everybody knows that because a lot of the questions that you always sent in, by the way, thank you for those questions, because that really helps me in terms of attending to what your needs are, as folks who come to listen to this presentation, that my information, anything you'll see on any of my slides is research based, not being an alarmist in any way, research based. So it's just a piece that I always have that, I think about, my God, 2021, 2020, talk about being like, oh, right? So look at all the anxieties we've had, parent family stress, moms that we've got, what is it, 2 million women who left the workforce, right? This past year. So we've been juggling stress at multiple levels. And for all of my parents that used to hear from me about minimizing screen times with your teens, when March of 2020 came around and they're like, Dr. K, what do we do? I'm like, I think you're going to have to release right now, because this is what's needed in this section. So we just really want to recognize that what we've been through is really huge, and that our teens and our young people are feeling a lot of the stresses of the racial issues, the fear of death, the fear of, a disconnection from their peers, and that discomfort that our kids are having right now as they're thinking about getting back to school and starting back and seeing their friends again, and not sure if they should hug their friend or not, and that awkwardness that our kids have right now. It's really hard. So what I'm going to cover are some statistics, what makes a resilient mind. I'll go into some core concepts of the brain. I talk about sensory processing disorders, ADHD traits, and I'm going to spend quite a bit of time explaining what is neurofeedback and how does it work. That's a big piece of it. And then all of you will receive a bibliography that is all the research studies that are done in neurofeedback. So I wanted everybody to receive that. So Megan will be sending that to you all for sure. So you'll receive a copy of that bibliography, and you'll see all the extensive research we have in the world of neurofeedback. I talk about what makes a well brain, how to serve the brain well. So you can tell brain is my passion. So currently we have 20% of our population that's suffering from anxiety. And the sad news is 80% of kids who would receive that anxiety diagnosis are not being treated. And right now, our levels of anxiety in the US are 3 times higher than they were a year ago. Understandably, why? We all know why, right? We're living it. And the huge statistic that I always like to share with my families is that between 2007 and 2012, teen anxiety shot up by 20%. And that I connect that directly to the rise of the smartphones, because we know that there's less of a connection, and there's so much stimulation that they're getting from those phones. That's hard for our kids. It's very hard for them. They're dealing with a very turbulent world with school shooters. There's all these toxic media outlets that they have. We've got ongoing domestic terrorist threats, the opioid crisis, and standardized tests have become so insane. And so our teens are really dealing with a lot right now, and we've got to have compassion, and we really have to have a lot of empathy for what our kids are going through right now. What's in I remember talking to one of my son's group of friends. This is, I think, when they were sophomores in college or something like that. I'm like, how are you guys doing with all these multiple shootings we hear about? Now, remember, these are the kids that are post 9/11. They're like, Mrs. Kakaya, we've become very accustomed to it. We're kind of actually we're desensitized to this level of violence, which is sort of sad for our kids to have gotten desensitized, but I also understand that that's their coping mechanism. They've got to have that. They've got to have some way of kind of putting it a little bit farther from them. So I like to talk a lot about what an emotionally resilient brain looks like versus what an emotionally crippled person looks like, right? So when we look at resiliency, you can see that emotional awareness that a person has. By the way, what I'll do also for all of you is I'm going to send my slides to Megan, and then she'll forward my slides to you. So you'll have a copy of my slides. So don't get panicked about writing everything down, because I do tend to put a lot of content in my sites, but I want you to be able to look at it afterwards as well. And the only caveat I give people when I share my slides is please share them with your friends and your colleagues, because the more we share these kinds of resources that are available, the more we'll feel like, okay, there are things that we can do for the brain that does not have to be medication oriented. So a resilient brain has emotional awareness, there's that perseverance, there's a sense of agency they feel about the world. You've got optimism, you've got that bounce back in that kid, and they're able to kind of take a step back and have a perspective on things, right? And a resilient person can laugh at themselves, and they can have purpose and meaning in the world. So ultimately, when we all signed up to do this job called parenting, the left side of the screen is what we want to create in our kids, right? I mean, that's really what we want. And then with the struggles that our teens are having post 2007, which I see this way more after the onslaught of the iPhones that we have, is, an emotionally crippled generation, which is like they'll constantly doubt themselves, they'll be indecisive. When I'm doing neurofeedback over here and I'm having one of my teens choose a film movie that they're going to watch, it's hard for them to make up their mind about what movie to choose. And then that whole struggle that our emotionally crippled kiddos have, which is they don't have that grit. They give up very easily. This is not worth it, mom, it's not worth it. I can't do it. I'm unable to do it. So there isn't that that reservoir of that ability of I can do this. I struggle, and I see, empathy levels have dropped very dramatically in this generation. Um, so they're very confused. Our emotionally crippled kids tend to have a lot of worry, a lot of panic, a lot of anxiety. I kid you not. I think parenting in this time, one of the toughest jobs any of us are ever going to do. So I empathize a ton with our kiddos who are struggling this way, right? So I talk about brain. So the brain is only 2% of the body mass. However, the brain uses 25% of the energy that we put into the body. So, when a big piece that I'm always talking about is when we're talking about anything such as anxiety or depression or ADHD or Asperger's or spectrum issues or anything like that, I want us all to start learning to talk about them as brain issues rather than mental health issues, because there's so much stigma that comes along as we talk about mental health issues, that it's nice if we can call them brain issues, because that's really what they are. Because if my ankle is sprained, I'm going to go to physical therapy and get that ankle healed. So when the brain is sprained, you can come to neurofeedback and heal that brain in that way. So those are ways to think about destigmatizing brain conditions. So I always talk about you know talking about mental health issues as brain conditions. God, this is a huge one. Lots of studies about, we know that the more screen time a kid has, the more they're going to have focus issues, sleep issues, unable to play, and then there's this very big study that was completed. It was a 8-year long study that was done. It was NIMH funded, completed, that showed a lot of evidence that in the long run, ADHD medications do not tend to have the sustained benefit that we would think they would have. So basically, we're putting the meds in there, but the meds are not having the long-term effect. What we do with neurofeedback is we're changing the firing of the brainwave pattern, and then the brain is actually changing permanently for itself. So what happens with neurofeedback is that we're making substantial changes that tend to stick. Now, what I do with my families, like say if somebody brings in like a 7-year-old for neurofeedback, maybe ADHD, then I tell them that, well, while we complete this one set of treatment right now, in a couple of years, come back again for about 5 or 6 reboots, because the brain will remember what we did with it and the brain will want to recapture that again, because between ages 12 and 22, 23 is when the brain is doing the most amount of its growth. So if you do come in for neurofeedback and you do rewire that brain to have that brain be more functional, what you want to do is give that same reinforcement a couple years later for a few sessions so that the brain can remember what we did with it. So when we look at core characteristics of ADHD, it is a dysregulation of the arousal system. Okay, the arousal system is our biological thermostat. Appetites, perceptions, ability to control things, impulsivity, soothe, gear up. That's one core trait of ADHD. The other piece is poor integration with environmental demands, so that you have a person who gets fixed on one thing and then they'll do the risky behaviors and their activities, and when they do that high level of activity is what makes them feel more alert and alive, which is why we have that hyperactivity in the brain. That's one. And then another core characteristic of ADHD is the perceptual and the focus problems. So that person tends to attend to the urgent rather than the important. And that's where, Megan, with what it is you do with all of that, you're teaching them how to prioritize, not to focus on the urgent, focus on what's important. And that's create like a like a systemic way in which we get the brain to remain more regulated over time frame. Um, the stressed brain syndrome is another trait of the ADHD brain. The person, they put themselves on a task, the brain freezes up, they get stuck, they get frustrated, and they give up and they stop trying. So those are some of the core traits. And then the other big one that we all see in our families is that flexibility. There's a compromised flexibility. So flexibility is that part of us that can change set, we can change our perspective. I worked on this piece of my project right now. I can shift to the next project. So that shifting, that flexibility is a hallmark of a healthy brain, of a healthy mind. So in ADHD brains, that dysregulation throws a monkey wrench into the whole system. And when those gears get jammed, boy, they get jammed. So that flexibility is liability that a lot of folks with ADHD cannot afford, because then you get stuck and you're not able to move yourself out of it. So the reason why I feel so much hope and I get so excited about working with ADHD and learning disabilities as well as sensory processing issues is that, think about ADHD from the perspective of a brain that's dysregulated. So you have that brain that's dysregulated, and what neurofeedback actually does is it makes the brain become better regulated. So when the brain is better regulated, the mind will tend to function better. So all my patients that come for treatment over here, one of the big things that I tell them is to think about it from the perspective of, like, the brain is, the gears are getting stuck. When we get those gears unstuck, then your mind can come online, because the brain now gets the way out of the mind. So my patients at the beginning, they do a double take when I talk about it that way, but then they start to understand that what we're doing here is we're regulating the brain so that the mind can come online and do the things that we want to do. So some of the changes that I see are just dramatic. Like, I have patients who stop being suicidal after about 2 weeks of treatment. It's just dramatic, the shift that happens. And these are kids who've been on all kinds of meds, and things have not really shifted any of it around. So this makes a really big difference. Now there's a plane that's coming through. So I might just give us a chance to just kind of look at my slide and do that. Okay, gosh, good. It wasn't too loud. All right. So I tend to see a lot of positive changes with attention, with focus. Now, we have very specific protocols we do for sensory issues. We have specific protocols we do for ADHD, if it's inattentive type, ADHD, if it's hyperactive type. And when I do my assessment, it gives me an idea of what type of neurofeedback I'm going to be doing with your child's brain. Um, biggest thing that my parents will tell me is, oh my God, I mean, I asked them to do something and they start doing it the first time around. So, like, compliance starts to improve dramatically. There's often a huge reduction in oppositional behavior because the brain is not pushing against everything. So, that if the brain becomes more malleable, more flexible, your oppositionality is going to reduce, right? If that makes sense. Had very good success with depression. Anxiety calms down, flexibility increases. So when you have increasing flexibility and you're not having a meltdown every time you're going from one transition spot to another transition spot, just think about how much things start to calm down in the family system. Um, and I'm super excited because I've treated so many patients very successfully over the years. So thinking about, so going to sensory processing disorder, you want to think about that in a very classic way as a traffic jam in the brain. You've got areas that get affected are auditory processing, multisensory integration, vision, tactile, inattention. So what's happening with processing, sensory processing issues, and those are different from ADHD. Now, some people with ADHD may have sensory processing issues. What's going on with ADHD is that we have levels of norepinephrine and dopamine that are reduced. With sensory processing issues, what we really have going on is loss of connectivity, a breakdown in the connectivity in the brain. So the type of treatment we do with SPD is different than what we would do with ADHD, just because the two conditions are very different from each other. And SPD kids are kind of like your out of sync kids. Those are hard to pinpoint because they can tend to fall through the cracks, and they struggle with processing stimulation. So that's and emotion regulation is something they have a struggle with. And what we want to do with neurofeedback is we're actually able to really do very good emotion regulation. I have some regions I put in the front here. There's a T4FP2, and that's for fears and phobias and emotional meltdowns. That's like your right brain stuff, the emotional stuff. When I'm doing work with ADHD, for example, because the kid might have a struggle establishing goals and focusing, I'm going to be actually in the FP1 area. So I'm in different regions of the brain depending on what we come up with our evaluation. So it's a complex disorder. 1 in 20 people are affected by sensory processing issues. In gifted children, those with ADHD, autism, and Fragile X syndrome, the SPD tends to be much higher. So this is something, you may have a kid who has ADHD, but you might have seen some sensory issues. You sort of want to have a person who's trained in identifying sensory processing issues to be able to do a very thorough evaluation. There are some very extensive evaluations that can be done so that you have that accurate diagnosis, because then your treatment is going to be based on that. So as I mentioned, kiddos with SPD, and so we've got, so the connectivity in the brain is the white matter in the brain. So with SPD kids, there's loss of connectivity in the white matter, whereas with kids with ADHD, we've got dopamine and norepinephrine issues that are going on. So neurofeedback is fantastic in increasing the connectivity. So this is what neurofeedback looks like, guys. So you or your child would be sitting on that chair. We've got them all hooked up. I'm kind of sitting behind over there. And on your screen, you have, with the systems I have, you have a movie that you can watch, and the screen becomes super small. And then when you are in the zone, in the region of your brainwave activity I want you to be in, then your screen remains big. And you have a teddy bear on your lap that buzzes as well. Best way I describe neurofeedback is physical therapy for the brain, because we're exercising that muscle of the brain. So what's happening is we place the sensors in different regions of the brain, and those sensors read the electrical activity of the brain. They're displayed on my monitor, and then it feeds back to on the visual what we want based on what I have in my software, what the goals are, where I want to make changes in the brainwave activity. So I feed that onto the screen, and your brain takes it in and feeds so it's operant conditioning. Think about it as operant conditioning. So you'll have kids that are very relaxed. Out of all of my equipment, I have this little guy here that's reading your brainwave patterns and feeding it into my system. That little guy is the one that's the most expensive part of all my equipment, but that's the one that's converting what it's reading, the EEG from the brain, into feeding it into my software. And then I can do my magic with what I'm going to be able to do. Training is very extensive for us with neurofeedback. So I like to talk about the regions of the brain first. The important thing to think about is medications change the chemistry of the brain, right? You've got your synapse here and you've got your other synapse. What we do with medications is we pop it in between the two synapses and it changes the chemistry of the brain. Likewise, electrical impulses in the neurons also change the chemistry of the brain. So the chemistry of the reason why neurofeedback works is because the electrical impulses are being changed around. The neuromodulation of the electrical impulses is what's happening in the brain. So the changes that happen when the neurons fire differently bring about changes in the neurotransmitter balance in the brain. So that is how neurofeedback works. Because, so for example, when the neuron is communicating from one neuron to the other neuron, when we're changing the firing of the neuron, we're actually changing what the neuron does with the neurotransmitter balance in the brain. It's a very powerful modality. So we've got our frontal lobe here, that's all our executive function, your motor cortex, which is movement. So, and the sensory cortex, which are all our sensations. My parietal lobe is the perception, making sense of the world, your math, your spelling. The occipital is your vision. And the temporal lobe, for ADHD and a lot of learning issues, I go quite a bit to the temporal lobe. I'll go to the parietal lobe because the hyperactivity is within our sense of ourselves in our body and in the world. And the parietal lobe, the P4 areas are the ones I'll go to, calming down the hyperactivity in the brain. And there's a lot of frontal work that we do with neurofeedback with ADHD in this region. And then we have regions in C3, C4, that's also a really valuable region. So what happens is brain waves are the ones that drive the neurons in the brain. So when we change the EEG of the brain, our behavior changes, our mood changes, our focus changes, our emotion regulation changes. We're able to remain calmer. It reduces our anxiety. There's, sleep and cognition issues that improve as well. When the neurons fire differently, the brain becomes more regulated in all these other areas that I have on my slide. In fact, I had a patient I saw this morning and he was like, wow. And this is only his third session today. Yeah, it's his third session. And he says, Dr. K, usually Thursdays are my worst days because I have so much on my plate on a Thursday and I wake up with this dread in my tummy and I'm like grumpy when I wake up and I know I'm going to be helping with the baby and everything. And he says, I woke up this morning and I didn't have any of those emotions that I usually have on a Thursday. And I was surprised. And he's like, my wife could even see the change in me, that I wasn't like doing my usual Thursday morning thing that I was doing. His first session was last Friday. His second session was on Tuesday. And today was his third session. So within 3 sessions, he's already noticing how his brain is doing a reset. It's just magical what I hear here. It's so fantastic. So what happens is the EEG, so my software, the EEG detects the abnormalities in different regions of the brain. And what we're doing is we're shifting those abnormalities so that we can get the neurons to function more synchronicity with each other. So for example, if I place a sensor in this region of the brain and there's some dysregulation in that region of the brain, what's going to happen is the neurons there, I pick up on what I pick up on, I feed back something different to the neurons, and those neurons start to become more regulated and they start to have more synchronicity within themselves. And then that crosses over to the brain, to the rest of the brain, because the whole brain wants to be really happy. So the way neurofeedback helps is it helps by changing the neuronal firing patterns of the brain. That's why it's non-invasive. I do have a machine where we do place a whole bunch of sensors on different regions of the brain, and we give a tiny electrical stimulation to the brain. And that machine I purchased specifically for concussions, because when people have severe concussions, that was a system that was used that has had a lot of success. So I brought that in for that. But with most of my other neurofeedback, it's non-invasive. There's nothing that's being put into a person's brain. But what we're doing is we're changing the neuronal firing patterns. The amplitude of the EEG changes, the variability changes, how the different sites communicate with each other. So when I have a sensor I've placed here and another sensor over here, I'm getting my right side of the brain to communicate with my left side of the brain through the corpus callosum. And so the whole brain is learning to communicate within itself in a more efficient manner. And the brain is very neuroplastic. So if I've done C3, C4, that whole region is going to give a lot more frontal SMR brainwave activity, which is the activity that's your calm, focused, alert. And because these changes are happening at the level of the neuronal firing, and those are changes that are happening in the cortical nature, the cortex of the brain, they tend to sustain because the whole brain is changing with neurofeedback. So these are our different brainwave patterns. We have beta, we have alpha, we have theta, we have delta. So a lot of times people with inattentive ADD tend to have a lot of delta brain waves in the frontal lobe of the brain. And our goal is to reduce the delta and increase the beta and the SMR brainwave. That's another brainwave. That's this one that's related to readiness for action and attentive listening. And the beta brainwave is the go that is related to the focus and attention. The high beta, if we tend to have a lot of high beta, we're excited, but also excess high beta in T3, T4 region, for example, usually underlies tension, anxiety, and a lot of tension in the body. So then we work on bringing that high beta down much more to the beta or the SMR, or even increase some of the alpha spindles, which is your calming brainwave. This is the one, the theta, when you have a lot of theta, that's when you're in deep thought, but excess theta and excess delta are indicated in ADHD brains. In fact, we have a biomarker for that we use in our world of neurofeedback that we submit even to insurance companies and things like that. So when we're working with the brain, we're working in all these different regions of the brain. We've got attention, you've got judgment, restraint of impulses, you've got sensory motor integration. CZ is a big one. For sensory issues and sensory integration, I'll often do P4CZ, I'll do C3C4, I'll do C3F3. For procrastination, I'll do C3FP1 to reduce the procrastination. So you can see that and the left back region of the brain is where we go to a lot of learning disabilities. That's the area of the brain where we do a lot of LD stuff. And then when I have folks that are on the spectrum, I do a lot of T4, T6, because what that allows them to do is it allows them to read cues in other people and read emotional signals from other people. So we have very specific regions of the brain that we go to in order to stimulate those regions of the brain. So you can see again, this is, the different areas of the brain from a different angle. And this is with all the sensory processing issues that we have. So we have speech areas, like if I have a child who's really struggling with verbal fluency, I'm going to be here and here in these areas, because this is a specific region for speech. So we have very specific regions for speech that we'll go to. So keep in mind that the rate of brainwave firing is related to our state of arousal. What neurofeedback does is it nudges the brainwave firing, therefore it impacts our state of arousal. So we bring down the arousal by nudging the brain to go to a different state. So what happens is that those underactive or overactive brainwaves show up on the EEG. And as I mentioned before, we stimulate those to reduce the sleepy waves and increase the SMR waves. inconsistent brain starts to become more consistent with neurofeedback. And what we're doing is we're teaching the brain the task of changing its own frequency. And the brain is very neuroplastic, it's very malleable. It likes the change because the brain wants to be happy. The brain doesn't like it when it has to work extra hard to keep itself awake, or it has to do all this motor activity in order to focus. So the brain wants that calming. And really, what we're doing is we're doing operant conditioning. We've taught the kid to go to a particular frequency, and then in subsequent sessions, we're reinforcing that same thing so that the brain learns it and holds it and keeps it. So typically 25, and usually when I do my assessment, it gives me a really good idea of how many sessions we need for neurofeedback. I'm pretty good at guesstimating what we may need depending on early developmental trauma or other things that could have gone on in the child's life. And I'm a stickler now. I say best here, but I'm a stickler for people coming 2 times a week because we're teaching the brain how to be different. And if we wait a whole other week before you come back again, the brain forgets what we're trying to teach it. And then my patients and family members get very discouraged. You don't feel like you're making enough change. And what I found is the most optimum is, and they can be 2 days back to back in a day in a row, or it can be like with a day in between or 2 days in between. I'm flexible with all that. But for me, coming twice a week is a necessity for the brain to learn the new things that we're trying to change. I just love the way instantly you'll start to see changes, and particularly for kids with ADHD, we'll often find that our kids will have all this energy late at night, like 6 o'clock, 8 o'clock rolls around, and the kids are like, "Okay, I'm ready to take on the world right now." So I have a specific region that's P4CZ that I'll often do, and I bring it at 10 hertz, a very low hertz, so that the brain can be calmed down enough for it to fall asleep at night, so that the motor's not going at 90 miles an hour. It slows down. So what happens is the first 10 sessions, mood, sleep starts to improve. Session 11 to 12, regulation emerges, clarity, focus, even keel mood, all that stuff. Complaining, my parents have said to me that complaining starts to slow down. They're like, this is interesting. They're not complaining. They don't seem to be as bored all the time. And then what we're doing at the tail end of those sessions, like between 25 to 35 sessions, 40 sessions, we're just really reinforcing and integrating those adaptations. So initially they'll come twice a week, but somewhere in that 25, 28 session range, we may go to once a week at that point, because I want to see what the brain does in terms of holding the new patterns it's learning. And if we find that the brain didn't hold the new patterns, then we come back to twice a week, and then we try again to start to slow it down. When I took my son in for neurofeedback, I took him in for a whole year. I just wanted, like, the best treatment possible, just because I never wanted to put him on meds, and we never did that, which is great. So what happens is when their brain matures enough, you'll see greater control, less impulsivity, more flexibility. They're able to hear the cues you give them. They can self-regulate better. They complain less. They get the homework done. You don't have to hover over them. And Megan, you'll start to see the changes. If any of your kiddos that you're working with are coming for neurofeedback, you'll be like, whoa, what's happening over here? It's really exciting, the changes you guys start to see. I always make a big deal about my kids being well fed before they come to treatment. And then after treatment, I don't like any of them to be on any screens on the way home, because a lot of kids want to, get mom's phone and start playing a video game in the car or something like that. I want the brain to take in the changes that we've made. And I also tell my parents that kids are going to be very tired after neurofeedback. So don't try to engage in a massive conversation with them or anything, because the brain has done all this exercise and it needs to rest. So you want to feed the brain well before you bring them for treatment, and make sure that you nourish them right after treatment, because they'll be very tired. So if you look at a QEEG of the brain, you'll see this is like what a normal brain looks like, and this is what the ADD brain looks like with all that excess theta. The red is the theta that's there. So you can see what's happening with the brain. And then this is their QEEG before neurofeedback with all that excess delta. And this is the QEEG after neurofeedback. Now, if this does not look magical, you know, so this is where you will start to see much more of the SMR burst. They get focus, attention, and typically this can be brought about within 25 to 35 sessions. So it's very dramatic the way in which the brain shifts. So the costs range here at Healthy Within. We don't take insurance upfront, and typically the costs of neurofeedback are anywhere from 150 to 225 per session. And so you're looking at, a decent chunk of change for an investment for a full course of treatment. And it's important to talk to your clinician about how they charge and what diagnosis they use, because there are some diagnoses for neurofeedback that are better paid than others. And it's always a good idea for them to know. And that code 90901 is a code that's much better paid. So we always put that code on all our super bills that we give to our patients and everything. And insurance companies, it's a really good idea to talk to them beforehand, before you start the neurofeedback, as much as you might be sending them a super bill. And I guarantee you, they will tell you that it is experimental. It is not well known, blah, blah, blah. And you say, no, 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 it is not, because neurofeedback has been around for 32 years. Anytime there's a treatment modality that's been around for 30 years, automatically it's supposed to not ever be called experimental. So these insurance folks who say that, they don't know what they're talking about. And then that's why I've given you all of those research studies about neurofeedback. And my goal would be that when you talk to an insurance person, you get their email and tell them, I want to send you all the research studies that we have about neurofeedback. It is not experimental, because you're going to have to be a little bit of the agent that speaks to them, because they've done this whole piece with calling it experimental, which really bothers me. So what we do is we treat a lot of conditions with neurofeedback, like a ton of conditions. Epilepsy, we treat anxiety. I've treated a lot of folks with addictions. I've treated a lot of kiddos with gaming addictions with neurofeedback. It's been very successful. Autoimmune conditions, because remember, what we're doing is we are improving the physiology of the whole brain. So when you look at many of these conditions, tics, arthritis, menopause, everything emerges from the brain. The brain is like the CEO of the whole body. So when you get that brain regulated, autoimmune conditions improve as well. We treat a lot of concussions. I treat a ton of PTSD. We've got major people in the field of PTSD who really espouse neurofeedback as the level 1 treatment of choice for PTSD. So it's a treatment that's a very powerful treatment that really addresses, and I've treated many people very successfully for migraines, and they're like, how come we never heard about it? And I think many of you had asked that question in your questions, is how come we don't hear about neurofeedback? Guess what, guys? We don't have a lobby like what Big Pharma has a lobby. Okay? We don't have the funds that Big Pharma has for us to be showing up first on Google, for us to show up, in all of, and for us to have ads. 2 countries in the world can advertise medications to consumers, the United States and New Zealand. There's no other country in the world that does direct advertising of any medication to consumers, because it's physicians who should be prescribing your medications, not you saying, oh, I think I need to be on Latuda. I read about Latuda. What can I do, with that? Gaming, there's a huge impact on the brain with gaming. We've seen a lot of ADHD that actually comes about from the gaming. And so a lot of times when I have kiddos I treat with ADHD, I really ask a lot of questions about other habits at home in terms of eating and all of that. So what gaming does is, the biggest damage that gaming does to the brain is, see this region of the brain called striatum. There's a lot of large scale studies that were done on the brains of gamers, and we found that the striatum becomes large. And that is, excessive gaming is defined 6 hours or more per week, guys. 6 hours or more per week. Most of your gamers might do 6 hours in one sitting, might do 6 hours on a Saturday, might do 6 hours on a Sunday. So we found that when we have a very large striatum, that tends to be associated with schizophrenia, OCD, ADHD, and addiction. So we really want to take a look at what gaming does to the brain and bring about. And I think when our kids are gaming, we want to, I like this Graham's thing that does the game glorify violence? Does it seem to reinforce violence? Um, Add up the total number of entertainment media hours that your kid watches. Does it seem to model violence? Does it include social or relational violence? Just kind of be thinking about those things when your kids are gaming. And the violent gaming is what I'm talking about that really impacts the brain negatively. Because there are lots of games that are good for the brain, but it's also very important to be minimal. I'm a big one to say if you're going to allow your kids to game on weekdays, let it be under a half an hour, because the way the rewards are set up with the games, they reward you at a certain point. So if you keep it just under that reward section that the gamers have set up, then your brain is not getting that dopamine hit, then your kid is not going to get addicted to gaming. That's why you keep the hours shorter on weekdays if you allow them to game. I think a very important skill. So what I'm going to talk about now are some tips and solutions for brain wellness, and I'm going to be wrapping up pretty soon. So if there's any other extra questions that came in, Megan, I want to be able to catch those, from what you might have gotten from your chat box there. So I think for me, as a parent who has been like working with families probably 35 years now, I think the biggest skill that we've got to teach our children is empathy. When we teach empathy to our kids, half the battle with a lot of behavioral issues is kind of like out of the picture. And we learn empathy through vulnerable experiences. And we all want to teach our kids to stand in other people's shoes, right? And my belief is that there are certain factors that make our kids succeed and be happy. Is that grit, their ability to delay gratification? Are we teaching them to serve their communities? Are we teaching them to give back? Are we teaching them empathy? And we want to teach them emotional generosity, because those are all the things that help a child become resilient. And this is one of my books that has been a favorite one over the years. Really good book. And big thing, please teach your kids the golden rule. I, 3 years ago, 4 years ago, when I was in high schools and doing presentations in high school groups, and I asked my high schoolers, how many of you know what the golden rule is? In an auditorium with 300 or 400 kids in there, 2 hands would go up. So there's something that we're missing the boat on in this heightened competitive environment in which we're raising our children. We're losing the core pieces of teaching them the golden rule, teaching them to look at their teachers in the eye and say thank you and please, and manners, because kids they'll text each other, and teenagers will text each other. I'm outside your place. Your kid goes out, you never get to see the child's face. They don't come in and say, hello, Mrs. Kakaya, how are you? You don't get to give them eye contact. So we really want to bring them back into the room with us again. Huge non-processed food. I'm sure you guys talk about that, Megan, all the time in terms of nutrition and eating all colors of the rainbow. I think any age child can be taught to meditate. 5 minutes, sit crisscross, close your eyes. We know that meditation improves the ADHD brain dramatically. So we really want to do that. I really like integrative modalities like acupuncture. Alpha Stim is this machine that we use that really helps with anxiety, and it's something people do in between neurofeedback sessions. It really calms the brain down. I talk a lot about fish oils, and because of my background being an integrative psychologist, there's a lot of training I've received in working with supplements and different kinds of things. So I'll often work with my families on that, which is within the scope of my training. I think nature is huge. When we need to kind of get out some more. And I think now that we'll start to get busy with things, maybe we might stop some of those amazing hikes we were having during COVID, but let's do those hikes. Let's keep up that nature. That's very important. And I think that, when we have these traits that I have here, these are some of our traits of of well-being. When we have prayer, we have self reflection, we have forgiveness, we have gratitude. And I think when we have connection, whether it's within a church, whether it's Girl Scouts, Boy Scouts, temple, I think those social connections tend to make us happy and make our children happy too. The brain really likes those social connections. We know that there's lots of studies done with folks with Alzheimer's, and that people who have a lot of social connections tend to be at much lower risk for dementia and Alzheimer's. So here are some books that I kind of like. This Screened In is a really good one. Glow Kids, this book is scary. It talks about all the damage that's done to the brain with video gaming. So there are kids who need combination therapy, right? So some of our children need a combination therapy. So they may have medication and then they will be doing neurofeedback. What I do when any kids come to me with any learning issues or ADHD is I'll often speak with the psychiatrist and I'll say, here's what I'm going to be doing. So you keep an eye. Maybe sometimes we go lower on the dosage of the medication. Many of my parents are happy just to go a little bit lower on the dosage of the medication. So um, keep in mind that it's talk with insurance companies and be sure that they know that it's not an experimental process, that it's very, very, there's a lot of research with it. It helps a ton. So Megan, I think this is my last slide, I believe. Yeah, this is my last slide. Yep.
Thank you. Well, you covered so much, and we do have questions in the chat box. So I'll go through a couple of them. Um, some I was gonna say some of you kind of covered here or there. I just want to make sure we address people's specifics though. You did talk about SPD. Anything in particular for ADHD hyperactive type? Is that, I'm imagining there's just, a certain protocol you have for the brain, and it's probably a yes, we can help with that answer. But
yes. So for hyperactive kids, for hyperactivity, I have regions here, the parietal lobe, because that's the body, that really calms down the hyperactivity in the body. It's very substantial. It's very dramatic. Yeah.
And another question is, are there any quantifiable, or is there any quantifiable marker of the changes by the neurofeedback approach? And I think that's probably dependent on what they're coming in for treatment on, right?
Yes, the quantifiable markers are, so when I showed that QEEG, you saw how there was all that delta in the frontal region of the brain, right?
Right.
So I don't do QEEGs at my center over here, but when I'm doing the actual neurofeedback, each of the brainwave activity that's showing up, it's showing up on a chart for me. And I'll often share that. I like to bring that out to the front with my parents or even with my patient and show them the way in which their delta is coming down in the session, what's happening with their SMR, what's happening with their beta. So they're actual quantifiable markers of what's occurring in the brain in the session that I'm able to share and show. But for me, the most important piece is how does the person feel after the session? Because with most of my systems, the most optimum effect of neurofeedback is felt 12 to 24 hours after the treatment. So I'm always asking parents, tell me how they were the next morning when they woke up. Did they wake up easier by themselves the next day? Were they less sluggish in the morning? Did it seem like they were more alert? What are the markers you saw behaviorally?
And with your assessment, does that start with kind of a brain mapping like what you were showing?
I don't do the brain mapping. No, I don't do a QEEG. That brain mapping is a QEEG. But
Okay.
I do a quick test, and there's another test, QIK, and then there's another test called CNSVS, which is a test of cognitive function.
Uh-huh.
Those are like standardized tests that I'll do before I start.
Uh-huh.
But my other part of my assessment is really, I want to learn about the whole child. I
Uh-huh.
want to know the whole child. So I go through sleep, then I have pain, then I have tics or any grinding of the teeth they might be doing. Then I have a whole bunch of questions on asthma, allergies, any physical issues. Then I have focus and concentration, one section there. Then I have behavioral issues like anxiety, panic attacks, empathy. self-harm behaviors. I have a whole section on that. Then I have a whole bunch of questions I ask about developmental markers as the child was born. So I want to learn about the whole child before
Mhm.
I begin to touch any part of the brain, because I want to make sure I serve the brain in the best possible way.
So when you're looking at results, you're really looking at what are the, observable changes in a child's life and in their performance in school. Got
Mhm,
it.
mhm.
Um, at what age, just as a question regarding screens, and at what age would you recommend for a child to be exposed to a screen?
Okay, so I have become militant about this. I'm like so thoroughly like freaking impressed with myself, because now the statement I make, which shocks people when I say this, because of the damage I've seen to my brains. I've been treating these brains for over a decade now. Um, if you are going, there'll be so many parents that'll be like, okay, the train has left the station.
Yeah.
That's fine. Train has left the station. You can still be the parent that's in control, that can take charge, that can decide that my child is too dysregulated with the phone. If your child is too dysregulated with the phone, you as the parent who's paying that freaking phone bill has every right in the world to change that phone out into a flip phone. It doesn't have any bells and whistles. It's going to be very uninteresting to your child. They'll barely use it, but you'll get them off that phone, right? Because we know phones are designed to be addictive products.
Mm.
They're designed to be addictive products. And we've all seen, I'm sure everybody's seen that documentary, right? Megan, remember that documentary that we all saw? What was that
We did
documentary?
Screenagers a while back.
Yeah, that one. But there was that other one that came out. That's the the heads of like big tech companies. They created that recently. Oh, it's on Netflix. I forget the
Yeah,
name.
I know. I've heard a lot about the people that, Silicon Valley, how
Yes,
opposed they
yes.
are to screen time for their own kids.
Exactly, exactly. So I now say that the most optimum time to buy your child a smartphone, you can get them a cell phone in third grade, fourth grade, or a flip phone, whatever. Take that all the way through middle school and high school. The most optimum time is second semester, senior year of high school.
Mm. So delay as long as possible.
Yes, ma'am. The second, and the reason I say second semester is because that's when your kids getting senioritis, they're getting bored, they're like getting done with high school and they're going to go off to college, and you want them to have that smartphone in college so they can start to use it now.
Yeah.
But what'll happen, and because remember, they will not have had Snapchat, they won't have Instagram, they won't have like all this social media stuff that is so oppressive on our kids. So oppressive.
Right. Oh, it's a tough world we live in because, yeah, as a parent, I know the screens are everywhere. They're everywhere.
And we can choose to have them everywhere or we can choose not to. And we know all my parents yell at me about this because everything in school is on screens.
Yeah.
Because everything in school is on screens and because they do their homework on screens, which is how we've designed it,
Yeah.
then why add all these extra layers of screens? We have a choice.
I get you. I get you. Well, there were some other questions that are more specific. So I do encourage everybody who did not have their specific question answered to reach out to Dr. Kakaya. We will share your email address. I know you have it here, but we will go ahead and share it in a follow-up email with the link to this recording too, so that they can have that to reach out to you.
Good.
I'm also going to share in the chat window. It's a link if anybody wants to just quickly share feedback for us. This is a link to our survey on the presentation. And we also ask for your feedback on future presentations, topics you want to hear, any ideas. If you know of an amazing speaker, we'd love to bring them in and share them with our community. So any feedback you can provide us while it's fresh, you can use the link in the chat right now. But yes, because we are at time, we can't take any more questions right now, but we will certainly, like I said, share your information. We will share your slides. We'll share your resources. And thank you so much for your time and your generosity and just being here, not just for us today, but for what you do for the community. It's very inspiring to me. And I love having you as a resource for the families we're working with.
Thank you. Thank you. This was a joy. And please know that I'm here for any questions you guys have. And thank you for hanging with us in at the tail end of the day when everybody's coming in and all that stuff too. Thank you.
You're so welcome. Well, everybody have a wonderful evening. We'll hopefully see you at the next event.
Take care.
Bye.
Bye.